The flu virus that affects humans, it changes from year to year. And the impact, unfortunately, we're not able to predict from one year to the other. Even when we have similar strains, the effect it has on the population depends, one, on the population, the characteristics. Have they been exposed to a similar virus in the past? And also on the characteristic of the virus that's causing people to be sick at that time. The symptoms depend on the individual who is sick. So if it's a young person, otherwise healthy, he or she may just have muscle aches, sore throat, and cough. But if it's someone who has asthma, or a very young child, or an elderly person with heart disease or COPD, those kinds of things, the person can actually get very, very sick and might even need admission to an ICU. The biggest thing in preventing the flu is to get yourself immunized. And thankfully now we have different kinds of vaccines. So we have the normal intramuscular one, which is the common flu shot that people can get. And recently, in the past year or so, we now have the one with the micro needle, which is given into the skin. So for those who are afraid of needles, that's an option for them. And then for a particular age group, 2 to 49, you actually don't have to get an actual needle. You can actually get like a spray in your nose to protect you from influenza. Absolutely not. So with the ones that are shots, whether intramuscular or intradermal, what happens is that it's a killed virus. So the virus is killed and they take pieces of the virus, if you will, and make a vaccine from that. Now the one that is sprayed in the nose, it's what we call live attenuated. So it's a live virus, but it's very much weakened. So it's not able to make you sick. The other very important thing about this one, even though it's a live virus, is that it only divides in the nose and in the upper airways. Now for influenza to make you really sick, it has to go down in your lungs and divide in your lungs, and that's where it causes illness. What we have in the flu mist cannot divide in the lungs, so no, you cannot get sick from any of the 3 types of the flu shot. The other very, very important thing is this. If you have symptoms that suggest you may have influenza, fever, cough, muscle aches, then stay home. Don't go to work or to school. Do your colleagues a favor and not share your infection with other people.